my name is Shilpa Heald, and I am a doctoral candidate at Florida International University in the Nurse Anesthesia program. My DNP project is on the use of intranasal dexmedetomidine compared to oral midazolam in the pediatric preoperative population for separation anxiety. The learning objectives for this presentation are to identify effective methodologies to decrease preoperative anxiety in the pediatric population. We will describe current approaches being utilized, including medications, doses, and routes of administration, and describe alternative options, including safety and efficacy profiles. Every year, nearly 5 million children and adolescents undergo surgery in the United States. This population is particularly vulnerable to anxiety. Determinants of preoperative anxiety include previous hospitalizations, anxious parents, being an only child, and not receiving adequate pre-medication. The effects of anxiety can lead to increased length of stay, tachycardia, hypertension, higher requirements for anesthetic medications, and several behavioral problems. Currently, the most utilized medication to treat preoperative anxiety in the pediatric population is midazolam. It can be given orally, nasally, and intravenously. Complications from midazolam include respiratory depression, possible contributions to emergent delirium, and, if given intranasally, nasal irritation. Additionally, midazolam has no analgesic properties. Studies have shown that even small doses of oral midazolam, 0.25 kilograms per milligram, can be effective in mitigating pre-procedure anxiety. Overall, oral midazolam is an effective medication. However, in high doses, adverse effects have been seen. There are a number of alternatives that are being utilized to treat preoperative anxiety in the pediatric population. These include clonidine, ketamine, propofol, etomidate, and nitrous oxide. Both clonidine and ketamine provide sedation and analgesic effects. Adverse effects of these medications range from bradycardia to nausea and vomiting. Propofol does not provide analgesic effects and may cause respiratory depression. Etomidate has been utilized during brief diagnostic imaging procedures. However, it can be painful at the injection site. In addition to providing moderate anxiolytic effects, nitrous oxide also has amnesic properties. Adverse effects of nitrous oxide include vomiting and dysphoria. Dexmedetomidine is a selective alpha-2 receptor agonist, and its effects on the locus coeruleus in the brain provide consciousness that closely mimic natural sleep. Dexmedetomidine is fast-acting, with its peak effects happening within 15 minutes. The intranasal dose of dexmedetomidine is 1 to 3 mics per kilogram. Adverse effects include bradycardia and hypotension, especially with bolus doses. Studies have shown and proven the efficacy and safety profile for dexmedetomidine. Intranasal dexmedetomidine can effectively be used as a pre-sedation for non-invasive procedures. Additionally, intranasal dexmedetomidine, either 1 mic per kilogram or 2 mics per kilogram, can reduce the resistance to parental separation, mask induction, and decrease the incidence of post-op emergence agitation. Intranasal dexmedetomidine is a safe and effective alternative for pre-medication in children undergoing surgery. Both midazolam and dexmedetomidine have been shown to be effective in providing sedation and reducing anxiety in the pediatric population. The predictability profile of midazolam has been extensively studied, and adverse effects include burning and nasal irritation when provided intranasally, possible contributions to emergence delirium, and respiratory depression. Adverse effects of dexmedetomidine include bradycardia and prolonged sedation post-procedure. In several comparison studies, it has been noted that intranasal dexmedetomidine attains satisfactory and significant sedation and lower anxiety levels with better parental separation than those that received intranasal midazolam. Additionally, children who were pre-medicated with dexmedetomidine had lower sedation scores, lower anxiety scores, easier child-parent separation, better mask acceptance, and lower pain scores than those that received midazolam. The pediatric population is a challenging subset of patients for anesthesia providers. They can have an increased level of anxiety not only from the procedure, but also from parental separation, fear of the unknown, being placed in foreign locations, and being surrounded by strangers. Currently, midazolam is being utilized as a pre-medication to mitigate anxiety levels in this patient population. Dexmedetomidine is now being studied and introduced as an alternative to midazolam. Studies have shown that dexmedetomidine is a safe alternative that has increased success in preoperative sedation levels and has been shown to result in decreased post-op nausea, vomiting, pain, and agitation.